Tuberculosis is one of the world's great killers. Over 2 million people die from TB each year, at the rate of 1 every 18 seconds. An airborne threat, TB has the potential to instantly become a global pandemic disease, affecting hundreds of millions of people. 1/3 of the world's population is infected with the bacteria that cause TB. Of that, 90% are carriers. They don't infect others and don't get sick themselves unless their immune system weakens. Detection and treatment of tuberculosis has not kept up with the advances in modern medicine. The vaccine used to treat TB is not efficacious and was developed 8 decades ago. Accurate diagnosis of the disease is difficult and requires more than one test. But research now underway at the Forsyth Institute in Boston offers great promise. Dr. Antonio Campos Nido, a leader in the field of immunology and microbiology, is at the forefront of a breakthrough in detection of TB.
Control of tuberculosis is a very complicated issue because of the complexity of the disease and because of the way it is transmitted. We know that to successfully control the spread of tuberculosis, we have to work on 3 fronts. The first is identification of all active tuberculosis cases in the world. In order to accomplish that, we first need to develop a precise test which can be used in remote areas where tuberculosis often goes undiagnosed until it's too late. We call this a point-of-care test. Second is to develop an aggressive treatment method because tuberculosis is a very transmissible disease. Drugs to treat tuberculosis do exist, but these drugs are toxic and need to be taken daily for 9 months. The third front is to prevent new cases to help control the global epidemic. That requires a new, efficacious vaccine. The vaccine that is currently used was introduced in the 1920s and does not prevent pulmonary tuberculosis. Our lab at the Forsyth Institute is in the midst of exciting research into a groundbreaking new method for identifying tuberculosis.
This is the ICS.
Our work is concentrated on a test that eventually could be used as a point-of-care test in all areas of the world, even the most remote villages. The test we are working on is modeled after a standard pregnancy test, which uses one of the simplest samples available in the human body, the urine. However, unlike the pregnancy test, a test for tuberculosis must be able to detect minute traces of the compounds of the microbe in urine. Fortunately, we already know the molecules of the microbe that causes tuberculosis are eliminated in the urine in minute amounts. So we have adjusted the standard pregnancy test to detect the presence of these molecules. Using our test, we have already examined urine samples from tuberculosis patients from the United States and several other countries. The most important aspect of our test is that it will distinguish active from latent or inactive cases of tuberculosis. It is estimated that 2/3 of the world population has latent tuberculosis, and every year 2.5 million people die from the disease. Therefore, any test we develop must differentiate the carriers from the infectors. A great number of people who progress from latent to active tuberculosis also have AIDS, which compromises their immune system. This is especially true in Africa, a hotbed for tuberculosis. An accurate point-of-care test will help health professionals identify active from latent tuberculosis all over the world. Our test is designed to make the process simple and does not require specially trained personnel or clinical setting. We are confident we can achieve our goal of a simple point-of-care test since we have already been able to demonstrate the presence of the TB molecules in urine of patients. To this point, our work has been funded by generous individuals as well as by major global health institutions like the World Health Organization and the National Institutes of Health. Both of these agencies are understandably quite concerned about the spread of tuberculosis. The NIH is particularly interested in tuberculosis research because while tuberculosis has tended to be a problem in developing countries, the United States is still at risk of tuberculosis epidemic. Science has not made much improvement in control of tuberculosis. In addition, the appearance of drug-resistant organisms poses a new and real threat. But neither the World Health Organization nor the National Institutes of Health is able to allocate funds to support the next step of our work. Phase 2 of our research involves clinical validation of the test in a point-of-care setting. We must perform clinical trials to demonstrate the effectiveness of our tests diagnosing active tuberculosis. That is why we are counting on greater individual and institutional support for our work. Tuberculosis has been a scourge of our planet, but with an effective and easy-to-administer test like the one we are working on at the Foresight Institute, we believe we can make significant progress in helping controlling the spread of the disease. I am Dr. Antonio Campos Nito, and I thank you for your interest in our important work.